Okay, right, let's do this. This morning I did a video on Trump's response to the coronavirus and why it was woeful. And I promised to do a video on the UK response, which is more complicated because it has somewhat divided scientific and medical opinion as to its appropriateness. So I've done lots of research, I've talked to people, I've made a whole set of notes here. So what I want to go through with you is herd immunity, flattening the curve or squashing the sombrero, the UK response in the light of both of those, what is the UK stated policy, what's my take on it, and then what my predictions are for where the UK is going from here in terms of policy. Right, so first up, let's discuss what we mean by herd immunity. And let's think about it this way. If this is the population, you want to, according to the sort of idea, sort of separate off, I can't see what I'm doing here, a few vulnerable populations, the elderly, those with respiratory diseases, and then, almost like a scorched earth policy, let the fire rage all around those little cocoons, right? Right through the population, all those that can take it because they're young and healthy, da-da-da-da-da. And then, that means after the fire has sort of burnt through, then these people can come out of their cocoons, and even if there are more coronaviruses trying to jump into the mix, all they find is scorched earth and can't catch through and get to those vulnerable people, because you've got over 60% of the population that have already had it, so are immune to it and aren't going to catch it and pass it on, right? That's the idea. Nice, clever little idea. If I were playing a computer game about how to handle something like this, you might consider that as a strategy. However, there are some problems with it. There are some big risks. First of all, if you're encouraging a fire to rage through, then you're still encouraging a peak to happen. And can you handle that peak? If those cocoons are not really secure, then you could easily have more cases in hospital than you can possibly handle, and you have encouraged it to spread fast. Also, if you're encouraging it to spread, you've encouraged that to happen early, maybe before you've got all of your preparations lined up. And then thirdly, as it rages through that population, that's going to knock out up to about a fifth at the peak of the workforce, including your health services workforce and so forth. So the bandwidth of your hospitals and your intensive care units are going to be reduced because of that. So it's a nice idea that you get this sort of like this raging through and protecting all these individuals, and then at the other side they're sort of protected, whereas if it's a partial burn, then you could have, for example, a second wave of infections come along in the winter, which could then go and get them. But there are a lot of risks with it. Now, the other thing, which is what the government were, and what most governments have been promoting more, is the flattening the curve, or as Boris Johnson said, squashing the sombrero. If you've got your infections peaking and then diminishing like that, and your hospitals have only got a sort of certain bandwidth to handle cases, then what you want to do in the entire population is make sure that it progresses a lot more slowly, so that even if it infects the same number of people, it's spread out over more time. That's usually what governments show. What you're really interested in is about the 10% of people that actually have to be hospitalised. So it's a little sort of curve that mirrors it under that. And then there's a proportion of those, colours. Then there's a proportion of those, then there's that will die, but you're thinking about your hospital bandwidth here. Sorry, keep changing colours on. Remember these pens? I love them. And so it's actually that proportion of people going to hospitals that you want to keep beneath a certain level so that the NHS can handle it, right? That's the idea. But, and what also isn't often pointed out, if you go for your herd immunity approach and this fire burns through quickly here and you're isolating off this population, you've got to do it for a shorter amount of time than if you're having a much slower and incomplete burn where you're trying to keep people protected for a very long period of time, which can cause, a lot of economic problems and social stress for the individuals involved and so forth and so on. That's the ideas now that you need to be aware of. Now, what is this government doing? Mixed messaging, actually, and that's part of the problem. But it started off with some private briefings about watch out for the term herd immunity. And then Boris Johnson was interviewed by Philip Schofield, and when Philip asked the very standard question, and very good question of, are we doing all these hand washing and social distancing measures in order that it all progresses more slowly, that the peak is lower, but it goes over a longer period of time? Boris Johnson's answer should have been yes, that's exactly it. But what he said was, there's a lot of theories. One of the theories is that we take it on the chin and we let it go through our communities and sort of do its work and then sort of be done. Without explaining any cocooning, which led a lot of people to then go and think, what is he talking about? This sounds farcically irresponsible that you just want to economically get it out of the way without any draconian measures and let it take out a big part of our population. So that was poorly explained, but he was saying that was one theory, but we realise we have to sort of blend it with another theory which slows things down. But nevertheless, it goes to show that was the thinking that was going on in government, and that had people worried for all the reasons I've just said. For example, the British Society of Immunology have written to the government and saying, you can't bank on this herd immunity, by the way, because you don't know if you're going to have immunity at the end of it. You don't know if that immunity is going to stick for a long period of time in those people who have had it. So it's not something that you can rely on. And the chief scientific advisor to the government, Sir Patrick Vallance, tried to explain that you do want the slow burn, but maybe you don't want to stop it too abruptly so that it continues in order to build up that herd immunity. However, now, because it has spooked so many people, the government are trying to say, no, herd immunity is not part of the plan. And they're focusing a lot more on that squashing of the sombrero, right? But there is more to what our government have been saying uniquely compared to other countries. One is that now that the containment phase of their plan has passed, they're going to be doing less testing. And secondly, that they're trying to factor in behaviour science, which is looking at how pandemics have gone previously. If you try to put in measures and keep people self-isolating for a long time, or adapting certain behaviours for a long time, after a while they could become quite tired of it, quite unresponsive to government messaging, and you could, on the sort of downside of a curve like that, have people relaxing those measures, and then you get a second peak or a flare up then. That is what they're saying. This is different from other governments, like China, South Korea, and the European countries, who've basically said, this is a real problem, we're just going to go in hard and fast to slow it as quickly as we can and buy more time. So the UK government is an outlier, as many people have been pointing out, in terms of its approach, in terms of thinking about that herd immunity, in terms of saying we are not going to impose draconian measures yet for two reasons. One is the implied herd immunity thing, but the reason more commonly stated by them is that we don't know how effective it's going to be, and we don't want people to be tired later on when they may have to take certain actions. But then also the reduction of testing is another unique feature of the UK government, right? What's my take on it? I should say at this stage, I'm a scientist, and so as a scientist, it is very important to show deference to other scientists who've got more experience in this area and more data to their hand. You know, regardless of who's senior to who, you recognise who's got more experience in the area. So it frustrates me when I see journalists be absolutist. I think, however, that the scientific community and those leading organisations that have interacted with the government are clearly divided in how they are responding to this. And so that is worrying for the government, because it has spooked the public a bit that we would behave in a more lax way as they see it. And it has spooked the public a bit that top scientific authorities are unsure whether this is a particularly wise approach by our government. I personally think I can't see a reason why you'd step down on the testing. Essentially, whatever we want to do going forward is going to need maximum information, and the testing required in order to get that is not very costly at all relative to some of the costs that could come along. So I think that stepping down of testing is a bad idea. And in fact, as I say this, the government are actually saying that they're going to increase testing again in different, particularly with the health workers, and I think they're going to be rolling back on that a lot. I think with regard to the herd immunity strategy, I think that spooked the public, I think that spooked certain scientists, and that is something that you shouldn't be planning on now, but that's something that you keep your mind on maybe for later as you see how things progress after trying to slow it down to the max. I think with regard to the behavioural measures, behavioural science is a very, very tricky area, and you cannot predict how people are going to behave later. I think perhaps it's not bad to start later than other people in terms of it not shutting down the schools, but I wouldn't want to promote the idea that you're quite happy for this to spread throughout the population. So essentially, my overall take on the government's approach is that theoretically it's a very clever idea if you knew exactly how this virus was going to behave and you wanted to minimize your economic damage. Then cocooning people and trying to let it flush through the population, if you had a strong NHS and your ability to catch the respiratory diseases, that would be a way to do it. But what the government are getting wrong is that they have spooked the public by not explaining it properly. They have spooked the science community, and so they probably should be backing away from that herd immunity thing and actually more closely following the model of China, South Korea and European countries. South Korea in particular has had fantastic results by being absolutely thorough in terms of all of its testing. And so what you're actually starting to see is that it's peaked and now it's descending. And we've got a God-given gift here. We've got such an advantage that we've been a lagging country. So China has gone forward, done its draconian measures, lots of testing, and now sort of flattened out in terms of their infections. South Korea has done the same. Europe's further behind, and then mainland Europe, many countries, not all of them, but like Poland and ourselves and Romania are further behind the curve. So actually, we can take the same measures, and then if we're worried about a second flare-up because there's been incomplete infection of our population, that issue is going to happen to China first, and then South Korea, first, equally first. They've both got that risk. So we can follow their lead. Instead of trying to be too clever on our own, we can actually take the strong measures that we've seen work elsewhere. Yes, it takes an economic hit, but God, that's so much more important than having your health services swamped and people dying unnecessarily. You follow that lead, very mindfully testing all the time so that the models in your country are better about what proportion of people have had it, what proportion are immune, and what you need to do now. So that's what I would think would be a smarter approach. based on all the information that I've drunken from government, that I've drunken from my colleagues who are professionals in this area. And what I predict will happen is that our government is actually going to be rolling back slightly from, their over, too clever by half initial approach, which was more contemplating some of that like rapid fire herd immunity stuff. And I think in order to reassure our public, they will be enacting those closures in order to also buy more time, mindful that our NHS is currently unprepared. There's lots of supplies that our hospitals need. A lot of them are also locked up in storage and have not yet been released by our government. So our NHS and our whole system actually does need more time in order to be able to prepare to have a better bandwidth on this. So I think slowly you're going to see the government disowning herd immunity thinking or saying that's for later. You're going to see our government bringing back the testing and saying now that we've got capacity to do testing in a more systematic or structured way, we want to bring it back because we want to be, the best in the world for modelling, and we're looking at the South Korean example. And I think they are going to sort of pat themselves on the back for going into shutting down schools later and saying, we delayed that as much as practically possible until we had good plans in place, and but then we took the responsible measures needed. So they're going to try and style it out, but largely I think start fitting into the pattern of the other countries, just so as not to spook the public, because here's a behavioural science, if you like. If you want to be able to guide this country through it, you need the country on board, trusting the government and thinking the government is taking strong measures in order to provide maximum protection. So I think that's where the government is most likely to go in order to reassure the scientific community, reassure the medical community, and with it all reassure the public. So I think the government's going to try and fall in line, but then, do some back explaining as to why it was slightly different at the beginning. And that's the way they're going to do it. Right. That's my predictions. That's my thinking at the moment. I love all the feedback you've got. And of course, this is something that we all keep an eye on in a non-judgmental way. We all keep watching the science and the good quality information coming through, sidelining, the over alarmist or over aggressive and over defensive things on either side. And this is the most responsible way to go about it. And as more information becomes available and as things change, I will just bring more updates. There we go. Thanks very much.